Yes, so I am Dr. Brittany Panico. I'm a board certified rheumatologist in the Phoenix, Arizona area. I have a practice in Gilbert, Summit Rheumatology, and happy to join again. I was here about a week or so ago. And today we're going to talk about arthritis and lupus. So hopefully this will be some good information for all of you watching and tuning in for the replay.
Definitely. So I know that we received a bunch of questions from our community and shared those top asked questions with you. Do you want me to dive into them right now?
Sure, yeah, I can go through them too.
Yeah, if
However, we won't.
yeah, let's just jump in.
Okay,
Wherever
awesome.
you want to get
So
started.
So I came up with a couple of my own that I think are important from a healthcare provider standpoint. So I added a few in there as well. But one of the first topics or this is kind of a question answer sort of session. But one of the first questions is, what does lupus arthritis feel like? So if you have a diagnosis of lupus and you're wondering, well, what exactly is the arthritis component? Or am I supposed to even have arthritis along with my lupus? So, lupus arthritis or arthralgia, joint complaints that we typically see in patients who have a diagnosis of lupus, can be very broad. It can be anywhere from just aching and sort of the feeling that you can't quite get your fingers to do what you want them to do, like trouble twisting or turning or pinching or holding on to something, and just discomfort with that, like a nagging, aching, just irritation that you just can't get your hands to work, all the way to an inflammatory arthritis where you actually have swelling of the joints, kind of in the smaller joints of the fingers, sometimes in the wrists or even the thumb. So it can be a really broad range of the way that you feel. And it's important to communicate what things you're having difficulty with to help your healthcare provider understand what that means to you and your lupus, because then we can tailor medication treatment options based on the way that you feel or what your exam looks like. So, lupus arthritis can have a broad range of feeling. It can be like a sharp shooting, stabbing, aching, nagging pain, all of those things, and just feeling like, again, you're having trouble moving your joints. And it's not just the hands. I use that as an example, and part of the questions we'll get into later on talk about some of the other joint parts of arthritis that's important to talk about. So the next question is, how is lupus arthritis diagnosed? Are there blood tests or x-rays that help us figure that out? And the answer is yes. Blood work can help us determine the overall inflammation happening in your body while the lupus is going on. So if you're having a flare or a new diagnosis of lupus, the inflammation blood work called sedimentation rate or ESR and C-reactive protein or CRP can help us determine if the symptoms you're describing are driven by inflammation that we can measure in the body and in the blood. So blood tests can be helpful. There isn't necessarily a blood test to say this is arthritis at this given moment of time. But again, that's where the whole discussion about what your symptoms is important comes in. Some patients with lupus have rheumatoid factor antibodies, or maybe a combination of rheumatoid arthritis and lupus. And some patients may also have Sjogren's antibodies, so SSA or SSB antibodies. And those can give us more ideas or clues as to whether or not we would expect you to have higher risk factors for more joint related issues along with your lupus. So I really advocate that patients, to the best of our ability, know what your blood work is that defines your diagnosis. Meaning that if you are somebody who has that rheumatoid factor test that's positive, does that mean that the treatment options that would fit best for you are a little bit more steered in the rheumatoid arthritis direction? Versus somebody who doesn't have that rheumatoid factor, we may be able to use other medications that don't work as well for RA, but still can help with lupus arthritis. And the great news is that so many of those medications merge together. And so they're both used for arthritis. But it's helpful to understand what your immune system is telling us about the symptoms you're having. So that's one way. Another way is that x-rays can be helpful, especially if we're starting to see that your joints are changing or you have decreased mobility. So let's say, for example, your elbow is really hard to straighten out or bend completely because it's swollen and tender. An x-ray can help us determine, is there fluid in that joint that may be contributing to why it's hard to move? Same goes for the knees and the hips. And so x-rays are really helpful, and even ultrasound too. If you have the ability to have ultrasound through your office or imaging center, can help us determine if there's a lot of fluid in that joint causing the discomfort that you feel. So patients with lupus can get inflammation that triggers fluid buildup in the joint. So imaging is helpful with that. The next question is lupus arthritis a disability? This comes up a lot because of the way that lupus makes us feel as patients. So, when we think about the arthritis specifically, if you are struggling to do things that are required for your job, meaning type, write, if you're struggling to grip or twist or stand, or you've had an injury that we'll kind of talk about a little bit later on called osteonecrosis, then lupus can potentially be a disability. However, I say that with the caveat that we want to try our best as your healthcare team to decrease the risk that lupus becomes a disabling event for you. So, part of it is the communication and our job during our office visits to help you to be able to stay functional and be able to participate in the things that you want to do and the type of work that you want to do. So we try really hard, again, to formulate a treatment option for you to help decrease the risk of disability. So can it be a disability? Absolutely. But do we want it to be? We want to help you be able to stay working and stay active and keep the range of motion of your joints. So I know that's a broad answer to that question, but it kind of really just depends on the actual scenario and what's happening at the time. If you're somebody who's hospitalized for a lupus flare, that in and of itself, that time that it takes you in the hospital to then get recovered and back on your feet is something that oftentimes we'll do short-term disability for. But again, our goal is that we help prevent you from developing a long-term disability. Some patients with lupus who have changes of their joints over long periods of time, and we call these swan neck deformities. And this is where the ligaments in our fingers particularly become a little bit lax or loose and stretch to where your fingers can almost bend in the opposite direction. And there may be a little curvature to the way your hands look. That is not specifically a disability unless it decreases, again, your ability to function with your fingers and fine motor skills. So if you are somebody who has chronic joint deformities from lupus, again, having that discussion about what you're able to do versus what you're not able to do is really important so that we can help get you on track as much as possible. So that's a really great question, and I talk a lot about that with my patients as well. The next question that I came up with is, I'm on medication for my lupus. I think I'm being treated, but my joints still hurt. And this comes up a lot when we think about flares. What do lupus flares mean to us as individual patients? And oftentimes when you're started on a medication, for example, it may not be specifically geared towards helping the arthritis pain in particular. Or your lupus may be so active that it's just not working enough by itself. And we have to escalate or increase your medication to help take care of the symptoms that you're describing. So, a lot of times patients will be on their hydroxychloroquine, for example, and just need a little bit extra something because they continue to have joint pain or joint stiffness or joint swelling even. And so then that's the conversation where we start adjusting your medication to target the symptoms that you're having. Of course, prednisone is a really easy way to help calm that down, but we want to be respectful and mindful about the long-term effects of just using prednisone over and over also, and come up with a better long-term plan that can help you not have to need so many doses of prednisone. The next segue into that is, I'm on prednisone for my lupus and my joints hurt, or I'm trying to taper my prednisone down to a lower dose and my joints hurt. There's a phenomenon that we can sometimes feel with prednisone withdrawal or tapering our prednisone that causes like an achy stiffness, almost feels like you're exercising really hard, kind of muscular pain. That's really common to feel in the legs, the thighs, the knees, sometimes the feet, the shoulders, the bigger muscle groups. And so part of that may just be that you're tapering your prednisone a little bit faster than your body feels ready to. And that's an indication that it might be better to slow that taper down a little bit or go in smaller increments to decrease the dose. Some patients on high doses of prednisone, like 20 milligrams or more for a prolonged period of time, can also get this. It's really not inflammatory, but it's this muscle feeling of weakness and soreness that comes from being on prednisone. That's actually a side effect of prednisone. So you can get joint pain because you're actually on too much prednisone. So again, having that conversation about what does your joint pain feel like? I really delve into with my patients. Tell me what it feels like and tell me the things that are hard for you to do. Is it standing, walking, sitting, gripping, raising your arms and doing your hair? What kinds of things are bothering you that make that difficult so that we can talk about, again, medication options and possibly side effects to your treatment? So that comes up a lot about medication and joint pain. The next question I have is, I have joint swelling in my hands, maybe my wrists, my elbows, my feet. What causes the swelling? And I kind of alluded to this a little bit talking about the x-ray or imaging that's helpful for evaluating lupus arthritis. With lupus or inflammation in general, even rheumatoid arthritis, we can get what we call synovitis, meaning inflammation within the joint itself. The fluid that is lubricating our joints can essentially expand, almost like how a water balloon starts to expand. And there's just not a lot of room for that to go. And so it causes this intense tightness and swelling and sort of bubbling appearance of our joints that we can often see and feel. The joint might, like an elbow, for example, might feel really squishy to touch it. Or your wrist, you might notice like a bubble on your wrist where it looks like it's actually swollen. So that's underlying inflammation coming from your autoimmune diagnosis. And again, that's where it's helpful to understand what your labs are showing, what your autoimmune antibodies tell us, because you may have, again, a little bit more rheumatoid like picture causing that joint issue. And we want to treat that a specific way versus, again, are we really adequately treating your lupus and making sure that you're on a good medication that also covers the joint inflammation that you're experiencing. So the swelling is just deeper underlying inflammation trying to make its way within that joint space, and it just causes an outpouching or puffiness of the fluid. So then leading into our next question, I have joint pain in my hips and knees. Maybe this is after a history of IV prednisone in the hospital, or if you go into an infusion center and you get an IV dose of steroid, or a high dose of oral prednisone. So again, thinking about 20, 30, 40, 50, 60 milligrams. Some patients are on more than that. So if you're somebody who has what we think of as large joint arthritis, the hips, the knees, maybe even the ankles or the shoulders, bigger joints, and they just really are painful. It's hard to stand, it's hard to walk. The thought about getting out of bed just makes you bonkers. This is something that we think about or worry about osteonecrosis. And this can happen with high doses of prednisone, especially when we're trying to treat lupus flares like nephritis or trying to save an organ if you are in the hospital with lupus. And so we want to worry about the blood supply to that joint, and particularly the hip and the knees. So some patients can have actual damage to the bone structure of the joint that leads to a different type of arthritis that's actually very serious and requires surgical intervention. So if you're somebody who has a history of big steroid doses, again, thinking IV steroids or large oral doses, and you're having big joint pain in the hips, the knees, the shoulders, that's something that we want to x-ray and maybe repetitively x-ray to monitor to make sure that we're not actually seeing dying tissue or bone that has lost its blood supply in there, because that's really important that we address. I've had patients, and unfortunately, in our best intention to try to, again, save an organ like the kidneys, that this happens and develops over time. It's common in young patients. It's common in prolonged hospitalizations when you're laying in bed, not doing enough activity to get that blood flow really going. And young patients may need hip replacements or knee surgery to correct that. So again, that's very serious and a different segment of arthritis in lupus patients in particular that we think about. So I really want to highlight that for people who have a big history of steroid use with their lupus. And then leading into the next question, is lupus considered worse than rheumatoid arthritis? I like this question because the language that we use is really important to what that makes us feel about our diagnosis and also about how we feel about medications that we're using. So with my patients, I don't like to say good or bad. It just is. You have this and we're dealing with it. You have this diagnosis and we're addressing how to get you better. So when we think about good or bad, that really puts a label on something that is desirable versus undesirable. Nobody wants this to happen. Nobody shows up and says, I want to have lupus or I want to have rheumatoid arthritis. So when we think about it in that perspective, we think about what are the treatment options and what have you done as far as how many of those options have you tried and what has been helpful for you. When we use good treatments and we treat appropriately in the beginning of your diagnosis, we can decrease the risk that damage happens. And that's our goal. We don't want to necessarily have a lot of damage happening to your joints. So in terms of which one is better or worse to have, it's really individual. It's really about how your body is responding to the treatment options that you're discussing with your healthcare team and determining which needs fit the way that your symptoms are responding and react. Because some patients with rheumatoid arthritis can have very severe rheumatoid arthritis and really struggle. And some patients with lupus can have very severe lupus and really struggle. But there isn't one that's better or worse than the other. It just is. It's just there, and that's what we're dealing with. So I think of it as a way to essentially just have a conversation again with our patients and with your healthcare team as a patient about, okay, what are my treatment options if this doesn't seem like it's working? What else could we try if I'm not getting the benefit that I feel that I need from my treatment? So I really like that question. Next question, is there a difference between lupus arthritis and other types of arthritis? Yes, there absolutely is. We already talked about a little bit about lupus arthritis. We talked about osteonecrosis of the bone because of a side effect, which is another type of arthritis. We talked a little bit about rheumatoid arthritis, which is more aggressive inflammation causing damage to the bone, the joints inside. So rheumatoid arthritis, again, just acts differently. It's not good or bad or worse. It just is different. And then there's ankylosing spondylitis or psoriatic arthritis. Those are kind of in the same family, which is different. So I have had patients with lupus who develop psoriasis, and later they have more of a psoriatic arthritis kind of picture. And then there's osteoarthritis, which is degenerative or wear and tear arthritis as our joints age over time. And then there's infectious related arthritis. So let's say, again, this is more common or more of a risk in immunosuppressed patients, lots of medications causing suppression of your immune system. You may be at risk for an abscess or an infection within a joint. So we want to be really cautious about something called reactive or infectious arthritis in patients who are on a lot of medication. And then there's other kinds of arthritis that may overlap specifically with males who have lupus. You can have gout in addition. Gout is a type of arthritis. So there are several other forms of arthritis in addition to lupus, and some patients may have more than one. Some patients may not have any of those. But as time goes on and our bodies age over time, it is very common to develop osteoarthritis, wear and tear arthritis of our bones over time. And so for our patients, again, as we're older, talking about what a lupus flare might feel like, you might actually be feeling the manifestations of that wear and tear type of arthritis, where your lupus medication might not really be helping with that. So it is important to, again, distinguish if there's a difference in what you're feeling. And that's where the imaging, the x-rays, and the ultrasound can be really helpful for us to figure that out. So I really like that question too, because lots of things can overlap with lupus, as I'm sure we've all figured out over time. So moving on to some of the treatment things that we talk about for lupus arthritis. Does CBD or THC help with arthritis pain? I'm an advocate that if you have a natural or an alternative regimen that seems to help, as long as we're discussing what that means, how often you're using it, and making sure it's not interacting with any of your other treatment options, then those things are great because, again, they just provide an additional layer of benefit to you as a patient. So if topical CBD or topical arthritis cream or gel, any of the over-the-counter sort of arthritis products like Aspercream or Voltaren gel, if those are helpful for you, by all means, they can augment what we're already doing with your other medication and treatment plan. THC specifically, we want to be careful about how we're ingesting it because, again, thinking about the effects on the lungs with vaping or smoking. But an edible, for example, as long as it's not making you feel, a certain type of effect that's undesirable, some patients really do find that it's helpful for the stiffness and that aching that they feel, particularly at night. So there are people who find that these things are helpful to help them relax at night and be able to sleep, especially if you're somebody tossing and turning a lot because of your joint discomfort. So I think it's as long as you have the discussion and are openly, honest with your healthcare team about how you're using these products, they can certainly be of benefit. I will just disclose that in specific states where pain management is regulated, which is the majority of our states, I know Arizona and California were very strict about pain management and the use of narcotic prescriptions. If you're following with the pain management group, they will often not continue to refill your medications if you are using THC or marijuana products. So even though they're legal in our states, I do just suggest that you check in with the laws in your particular area and how that helps or may make it a little bit more challenging for you to have that relationship with your pain management team as well. So there is just a little bit of a caveat of we don't necessarily want to advocate using them if it takes away from a relationship that you've already agreed to with another healthcare team. So a little bit about that. Next question. What are the top treatments for lupus arthritis right now? This is a huge topic, and I'm just going to really zoom through them. So I apologize that I seem like I may be talking a little bit fast. There are lots of things helpful for lupus arthritis, and the foundation that we use, unless you have an allergic reaction or have had issues with your eye monitoring, is the hydroxychloroquine or Plaquenil. That is the one that we start with and the one that we try to keep our patients on because the overall effect of that over time for your lupus is so much more beneficial than not having it on board at all. But again, tolerating it and not having an allergic reaction to it. Prednisone can be helpful in short sort of bursts or periods at lower or moderate doses. So that's an option too. But again, we try to limit how much prednisone we're using over time as to not cause then damage to your joints, your bones, other issues, your skin, weight management, things like that. So a little bit of caution with the use of prednisone over and over and over. Methotrexate is helpful for joint pain relief and treatment, especially if you're somebody who may have that positive rheumatoid factor antibody. So if you're a rheumatoid lupus overlap that we consider you may have a little bit of both, methotrexate can be helpful. Methotrexate, though, we want to make sure is not interfering with your kidney function. So if you have lupus or nephritis or lupus in your kidneys, methotrexate might not be the best option to help you with your joint pain. And then there's azathioprine or Imurian that can be helpful for lupus-related arthritis. Mycophenolate or Cellcept, I'm trying to use all the terms of these medications, is really commonly used for patients with lupus nephritis, but might not be as helpful for the joint pain or arthritis. And this is again where that conversation with your healthcare team comes into play of how are you doing overall? And then there's the infusion products like Benlysta, which is an injectable, Safnello, and then rituximab, which may be plus or minus, for patients with rheumatoid arthritis as well. So there's lots of treatment options. There's more coming out. We're having big updates in rheumatology about newer medications being approved, and that's really exciting. And then I want to at least get through one more, and then we can answer any other questions that are coming in from our live stream. Does lupus arthritis cause permanent damage? And how do we decrease that risk? It potentially can if it continues to go untreated or undertreated. So it is really important that we stay on top of your symptoms and your flares so that we don't just let you linger on with a lot of joint pain and swelling, particularly again, if you're somebody with that rheumatoid overlap. So it is possible that it can cause permanent damage, but our goal ultimately is that it doesn't for you. So I know we went through things really quickly, but if there's other questions that have popped up as we've been chatting, I'm happy to answer a few of them.
Awesome. Thank you so much, Dr. Panico. We do have live questions. Suzanne is asking, is carpal tunnel a lupus symptom?
It can be, especially if you have inflammation or swelling in your wrist or possibly your elbow. So as that nerve is coming through the elbow into the wrist and into the hand, it can be a symptom. And the surgeon is probably going to say, we want good control over your lupus before they're willing to do a surgery to correct it.
Definitely. We have another question here, which I think that you already tackled, but does Plaquenil help specifically with arthritic pain?
Yes. I love Plaquenil to help with lupus arthritis. And we just have to be careful about the dose that we're giving you long term. So I will sometimes temporarily increase it during a flare and then bring it back down if it's appropriate for somebody's weight. So again, knowing when and where we adjust that is important. But yes, it is very effective for lupus arthritis.
Perfect. And Jen is asking, what's the best way to combat the fatigue and the weight gain?
So I think a lot of times it depends on where it's coming from ultimately. If it's a side effect of your medication, then trying to see if there's a substitute that you can be on something different and not have that same side effect. Fatigue can actually come from prednisone too. So if you're somebody again on long-term prednisone, there is an association with a lot of low energy and just that feeling of, blah when you're on prednisone. So that might be a factor. Other ways are, again, just working with your team about lifestyle modification, if that's possible. How can we help you exercise and be active and still feel energized from that? And one thing that we didn't really talk much about is food and relationship of food to the symptoms that we feel. So some people feel that certain foods are triggers to make us feel drowsy or sluggish and then ultimately gain weight. So things like dairy for some people can be kind of triggering. There's a whole lot of talk out there about nightshades and how that affects the way that our body feels. And it's really just determining if there's a trigger for your individual body and if that makes you feel a certain way.
Interesting. We have one more question here. Is topical arnica effective in treating arthritis pain?
So I would say the topicals are helpful in addition to what you're already taking as a pill or IV or injection. So by itself, we wouldn't expect the topical treatments to penetrate all the way deep inside to the muscle and tissue. enough to change that pattern over time. But they are really helpful at just loosening up the way we feel. And sometimes it's heat too. Sometimes those topical things help sort of stimulate more blood flow. And when we're not so cold and tight and our body and our blood vessels open and we loosen up and are warm, that can really help some stiffness and joint pain, especially if you're a patient with Raynaud's, that color change in your fingertips. So I definitely do think that the topical things can be helpful, but they don't ultimately do the same thing that a pill or an infusion would at the root of why the pain is there in the first place.
Sure, that makes sense. Perfect. Thank you so much for your time. That was so
Yes, thank
helpful.
you. Thank you. I'm so happy to be back and hopefully people catch the replay as well.